It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
Our guest today is Renee DeSilva, CEO of the Health Management Academy, partnering with top healthcare executives to shape the industry's future. With over 20 years of experience, she is a sought-after voice on healthcare transformation and diversity in leadership. Renee hosts the popular podcast, The Academy Table, and previously served as a Chief Talent Officer at EAB. An authority on leadership, Renee is blazing trails to transform healthcare. Renee, welcome to the podcast.
Hi, how are you? So good to see you.
It's good to see you again. And you've been incredibly busy your entire career, but things really seem to pick up the older we get. And wanted to get a chance to chat about your leadership. And thank you, obviously, for all that you do for all of our patients throughout the country and the world. So appreciate you taking the time.
My pleasure.
So one of the things I want to start with is, the Academy itself. Many of our listeners are probably familiar, but for those who aren't, what are the big things that you're doing and your team is doing to help shape the future of healthcare leadership and healthcare in America?
Yeah, thank you for the question. So the Health Management Academy believes in the power of community to drive health forward. And so we really try to create very sort of small, bespoke conversations and salon-style discussion to really figure out how we influence healthcare. And so I think the way that I typically think about that is we'll gather in a room full of physician leaders or CEOs and really try to capture how do we as an industry drive through all the headwinds that the industry is facing. I'm sure we'll get into some of those headwinds in our time today, but it really is a pleasure. We work with about 2,000 executives across the country, and really try to get into the art of the possible around how do we continue to move health forward.
Yeah, and it's such a great environment. I have been fortunate to be a participant, and you and your team really do exactly that and get a great discussion among leaders, very open communication. Everybody, opens their kimono and says, oh, wow, we've got this problem. Has anybody else seen this? And it's really, really valuable to be that communicative. You work with many leaders throughout, and those insights give you a very valuable position in our healthcare community. What, through your lens and through those discussions that you've had, inform our listeners here that healthcare leaders are looking at in the future? What are the expectations? What are some of the key challenges, and how are people addressing some of those?
Yeah. I would say I've just been struck. So we host probably 85 events over the course of a year, and we curate, the right topics based upon the audience. And there is an evergreen theme around how do I show up as a more effective leader? And both first leading myself and meeting the moment that's in front of me. And then how do I influence the broader folks around my orbit? And so when we spend time on that, and this is across every audience, CEOs to pop health directors and everything in between, it's a lot around how do we think about the qualities of great leadership? What are the traits that best-in-class leaders exhibit that maybe others don't? How do we think about managing and motivating our teams and working through change management? It feels like the one thing that we all can be prepared for is the fact that things are going to evolve and continue to change. How do we think about communicating that with our colleagues and folks that are up and down and across the organization? And so I think a lot of what we have been anchored on is how do I examine and address my own gaps? And then how do I take that to lead diverse groups of healthcare team members towards continuing to make a really positive change?
Yeah, that's fantastic. I mean, we can all be better. Nobody is in a position where they say, I've learned everything I can learn about how to be a better leader. So I certainly appreciate that concept. And it does start with you. The man in the mirror, man and woman in the mirror is where everybody can start. And, in that context, we like to talk here in the All Physicians Lead podcast about the fact that every doctor and many others in the healthcare environment. I don't want to minimize the impact that the leadership of all of our teammates has on the healthcare environment, but physicians in particular sometimes aren't aware that they're leading. I'm just a doc in the clinic, or I'm just a surgeon in the OR. I'm not really a healthcare leader. What are your thoughts on the concept that the folks in those small unit teams, in the trenches, if you will, out in front of our patients, how do they get better at, and how important is their impact on our healthcare systems, every minute of every day?
Yeah, I mean, I think they're at the sort of in the throes of what makes the healthcare experience either thrive or maybe not meet the moment, right? So their role in addressing challenges proactively, the burden around care coordination, the ensuring that we are all thinking about an optimized care and evidence-based practice that is easy to access and efficient. I think there's they really have a important ability to determine the trajectory of healthcare teams that then determine patient outcomes. And I see that, like I see the light bulb going off in many of the physicians that we work with around their ability to do that in an outsized way versus maybe someone who is a little bit more removed from the day-to-day of care delivery. And so it's been encouraging to see physicians embrace that and being open to maybe pushing through some of the common misconceptions about physician leadership.
Yeah, and there are, my mind, many ways that physician out in the front, in the clinic, in the ER is impacting that care environment. From your view, what do healthcare leaders, physicians, your team think are the key ways that physician behaviors, physician leadership actually impact that at, my naval colleagues would say, on the deck plates, right out front where the patients are being seen?
Yeah. I think there's a number of things. I mean, the importance of psychological safety, right? In terms of how you show up in the moment. This note of, we talk about it in this notion of on-stage leadership, meaning people are observing what you're doing, even when you're not aware of it. And so every minute, right? And so how do you want to think about that? And how do you want to approach that? We think about just the power of communication really at all levels. I mean, a lot of the work that we've been leaning into on communication talks about, for any leader, if you think about, you often have dyad models of leadership where you might have a physician and a nurse, like the new dyad models of any leadership circle these days. We might have a CEO and a CFO. It's also the chief communications officer, right? Like if you think through how do you communicate through organizations these days that have sometimes 5 generations of workers that have, Gen X to Gen Z and maybe some baby boomers as well. Like it just creates an environment where you have to be really particular about not just what gets done, but the way in which things get done, which I think can sometimes be a shift from maybe how it may have been. I'm not a physician, but maybe that may feel like a shift in terms of importance of the how and not just the what.
It sort of plays into the idea that our current vernacular, when we ask a physician to name some physician leaders, they inevitably will rattle off their department chair, the chief medical officer, maybe the CEO happens to be a physician, and not say me. So, when you have these discussions, what sort of things do you propose, does the academy, say to folks to alert them and make them aware that, no, you are a leader every day? How does that message translate?
So we try to just maybe think of it as myth busting, or what are the common misconceptions that are held. And, we do this. We run a 6-month immersive physician leadership development program, and we hold these, and we bring a cohort of people to our offices in Roslyn, Virginia. And we do this in sessions where they are in rooms with folks just like them, meaning they're not chiefs, they're not chairs. They're practicing physicians that may have some level of like formal leadership responsibility or formal administrative responsibility, but many of them are, 80% of the time still in practice. And so we myth bust. So I'd say one myth that we try to bust is that physician leadership is solely about holding a formal title or administrative role, right? And we say, no, it's about
Absolutely
influence.
key. Yeah.
Yeah. It's influence. it's decision making, it's guiding others, it's like what we all do daily, regardless of official role. Another myth might be that if you are in a leadership role, it detracts from clinical practice. We would say to be effective here, it's about enhancing the clinical impact and advocating for better patient care practices and returning joy to work, right? So that would be maybe a second one. And maybe the third myth that we really try to bust is that leadership skills are innate and cannot be learned. And we don't think that's true. I mean, I don't think you do either, right?
Not at all. Not at all. Yeah.
But a lot of these skills, it's keeping the growth mindset and really practicing just like you would if you were, when you were in your residency days. It's like just spending time and focus, you can develop this sort of skill set and hone it more and more over time.
Yeah, that growth mindset from Carol Dweck all the way back to General Eisenhower and Socrates, the idea that, you keep learning and growing. And in that regard, the concept that physicians have this psychological size, that it's not to say that we're all that by any means. But, you mentioned earlier the concept of psychological safety, and psychological size is a component of that. I've, for decades, introduced myself as Leon everywhere I go, whether it's on the phone or in front of the team, and nobody calls me Leon. They call me Dr. Morse. I'm like, but I've been Leon longer than I've been anybody else. But that speaks to the idea that we want to be just one of the team, and we're not filled with hubris and think that we're all that as doctors. We don't want to be perceived like that. But if you don't recognize that people might not see you as just another team member, one of my mentors in the past, the Navy admiral, would say that self-deprecating humor is the only kind that commanders can afford. And, as a doctor, if you poke fun at a team member, that may not be taken well. And creating that psychological safety within your organization so that people feel free to speak up, I think is extremely important. People join organizations but leave bosses.
That's right. That's
right.
right.
And that's a very oft quoted leadership, important statement.
Yeah. And I also think maybe connected to that too is just not being mindful of the power, like what you are in a position of power and influence. And with that comes a heightened sense of responsibility and sensitivity and just maybe mindfulness around that. And so I think that's really true too. Like even in my own leadership style, I think sometimes the more senior I become, the more empathetic I need to be, the more I need to listen versus talk, the more that I need to recognize and seek out diverse opinions, because the currents are going to want to go with like what they think I want to hear. If I'm in circles where I'm deemed to be the most senior person in the room. And I think that's true for docs in a lot of environments as well. So you almost have to over-rotate to, flex a different muscle to be able to.
Exactly. When somebody gives you feedback, be effusive about how important that is. And thank you for giving us that feedback, and, really show the rest of the team that that's an important thing that you need, because, back in my military days, anyone on a firing line could call a ceasefire. And it didn't matter if you were the commanding general or the brand new private. And in the operating room, in the trauma bay, in the clinic, we need to be able to have folks that are comfortable saying, hey, there might be an error here that could negatively impact this patient's care. And if people aren't willing and feel comfortable doing that, that's a real safety and quality issue.
For sure. I talk about this a lot too. Feedback is a gift, even if it's hard to hear. And just putting yourself in situations, putting yourself in feedback-rich environments, and that's not always in a downward context. It doesn't have to come from your boss. It can come from your peers, and oftentimes it can come from people in the organization who, on paper, might be less, maybe earlier stage career than you are, and really finding ways to seek that out and staying neutral and non-defensive when you get that feedback back. Yeah,
exactly right. I mean, one of my favorite things to tell folks to do is to take some sort of a leadership inventory and then give it to, 3 peers, 3 quote subordinates. I don't really like that term either, 3 bosses, and then compare and see if people see you the same way you think you're presenting. And that can be hugely helpful.
Yeah, agree. You'll see the gaps too, right? You'll see the moments where, gosh, if you are part of my core team, you may view me as very nice and easy to work with. But if you are in a department that I have to collaborate with, you may view me as having sharp elbows, right? So just even the leadership shadow or sunshine that we create sometimes will vary depending upon the ecosystem that we're operating in, which I think is also just a good takeaway for folks who are trying to hone this part of their skill set.
For sure. So let's say you have a group of brand new docs and you're in this auditorium with a bunch of interns and residents who are just getting into the field. They are out there, writing orders. Their behavior is having an impact. What do you tell those brand new docs about the importance of recognizing that they are leaders, that they have impact, and how to get better at it?
I guess I'd continue to sort of hone in on some of the themes that we've talked about, right? Like breaking down. When we do this, and we probably deal with people who are a little bit more, I guess, further along in their career, but it would really be around helping them start by just learning more about themselves. So whether that's through a personalysis assessment or a performance index, but like really spending some time studying yourself and the things that you think, like who are you under stress and pressure, which I imagine this group that you've just defined operates a lot under stress and pressure, right? And how do you show up on your A day versus how you show up on your B day is something that you should all be aware of. So I think I would tell that audience of maybe early entrance into first invest in understanding yourself and understanding what your sort of like what makes you tick. Who are you under these various moments, and just be aware of the impact that you have around others. Like I think that's the mastery. It's like just starting there, and then I would move through a continuum. But like that very early stage professional, and I again, even outside of physicians, any early stage person who's coming from formal training into any sort of practice, it's like focus on yourself, be excellent at what you do, treat people kindly, understand the way in which you show up can either you can either put energy into a room or you can take energy out of a room. And are you aware of what you're doing? That would be my thing one.
Yeah, no, that's brilliant. And, everything I need to know, I learned in kindergarten, right?
A little bit.
Be nice, put your toys away.
Yes, share with others.
Listen to the teacher.
Lift your mask. Yeah.
You don't have to color within the boundaries all the time, but, generally speaking, yeah, no, that's great. I wanted to dive in a little bit with our audience about the training programs that you were talking about, and specifically, what sort of outcome measures do you use, or do you encourage the physicians who go through your programs to use to say, hey, that was beneficial? A lot of times we go through these programs, and while we're sitting there, we think, wow, these are great ideas, but might not be able to stick. And what's the long-term gain, intermediate term gains that people see?
Yeah. So we try to do a couple of things. One is we sort of believe that the way that you continue to develop in any of these roles is both in the learning, but it's the application. And so for most of our leadership development positions, we try to assign or try to embed an action project into it. So, go back into your organization and go find a problem and work with your colleagues to solve that problem, and then come back and report back to that. When we've done these action projects, what we typically find is like folks end up building relationship capital with folks outside of their day-to-day orbit, which end up serving them really well. And so we see for folks that come through our fellowship program, which is a little bit more sort of more mid to later stage of career, we see a 90% promotion rate for those fellows. They have an alumni community that is incredibly well connected. And so when they are moving from organization to organization, like they are able to connect and learn from things that are happening in other places. So I think it's both career velocity is one measure, like how quickly do you achieve whatever your career goals might be. And then I think the building of a person, like a network or a board of your personal board of directors is a second. We also pair our folks with coaches that can be a bit of a safe space to explore the things like you're stuck on and your maybe the blind spots that you're trying to work through. So we would sort of say another way to assess is, are you making progress on those blind spots? Because you now have sort of a safer space to contemplate that. So those are a few of the things that we point to when we're looking at, how do you evaluate success over a longer term horizon other than I completed the assignment.
Right. Nice. So one of our listeners might be saying, oh my gosh, how do I take advantage of that? So shameless plug here. They go to their hospital healthcare system leadership and then access you through them, or how do they do that?
They can come directly to us if they go to www.hmacademy.com and look up our physician leadership programs or our fellowship programs. They can learn more there. Reach out to a member of our team, and then we can help map to some of these you need to be nominated for, and some of these you can sort of self-select into, and we can help map that through.
Cool. Yeah, well, thank you. You hear that, everybody? Pay attention. Get that down.
Appreciate that.
Okay, Renee, sounds good. I'd like to pivot our conversation slightly, but first, let's take a quick break. Coming up next, Renee DeSilva, CEO of the Health Management Academy, will discuss building resilience in leadership development.
Resilience is not just about how me as an individual steadies myself or manages my stress. It's also about what changes in the environment need to be driven so that the environment itself is not a boiling pot of water.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.